Hello everyone, welcome to CAPSA. Today's topic is migraine. So, what is migraine? It is a specific neurological syndrome that happens episodically, including painful headache with or without aura. So, what do you mean by syndrome? It is a set of symptoms or conditions that occur together and suggest the presence of a certain disease or an increased chance of developing the disease. Okay? What do you mean by aura? The sensory symptoms which can be neurological, gastrointestinal and autonomic. So what happens when a patient feels the migraine attack? Throbbing headaches occur unilaterally first but slowly spread to the opposite side of the head, including pallor and palpitations. In some patients, they may feel nausea and vomiting during the attack. Women are more affected than men. Okay. Now, what do you mean by pallor? This means paleness of your skin tone. What do you mean by nausea? An urge to vomit or vomiting tendency. Now, what are the pathophysiology of migraine? First of all, we need to know what do you mean by pathophysiology. When the normal physiology leads to the pathological conditions known as pathophysiology. So, in the pathophysiology of migraine, when trigger or stimuli occurs, it acts on the meningeal blood vessels, okay, which causes release of vasoactive peptides from the trigeminal nerve endings, which causes vasodilation of the meningeal blood vessels, which leads to pain and throbbing headache in the unilateral part of the head, okay, due to trigeminal nerve. What are the trigger or stimuli? It can be hormonal changes in women, or it can be drinks like alcohol, or it can be bright light, etc. Okay. Now, what are the types of migraine? Migraine types are two types based on the aura and based on the duration and severity. Based on the aura, it is of two types: common migraine without aura, classical migraine with aura. Based on the duration or severity, it is of three types: mild, moderate and severe. Mild attack lasts up to 8 hours. Moderate attack lasts up to 6 to 24 hours. Severe attack occurs more than one attack in a month. Okay. Now, what are the clinical manifestations present in the migraine attack? That is sonophobia, photophobia, chills, blurred vision, vertigo, loss of appetite. What do you mean by sonophobia? Sonophobia means fear of sound. Photophobia means fear of light. Chills mean feeling cold. Vertigo means a sensation of spinning, which creates a problem to the inner ear. Okay. Loss of appetite means not feeling hungry. Not feeling hungry. Okay. Now, what are the treatment? So, treatment can be done in two ways. One is abortive type of treatment and another one is prophylactic type of treatment. So, for the abortive treatment, which is done after the migraine attack to abort the attack, these are NSAIDs, ibuprofen, naproxen kind of drugs are used. Anti-epileptic drugs like metoclopramide, ergot alkaloid and its derivatives like ergotamine and derivative seed is dihydroergotamine are used. For serotonin reuptake agonist, sumatriptan, which is important drug, is used. Now for the prophylactic treatment, which is done before the migraine attack. Pro means before. Okay. Phylactic word comes from phylaxis, which is a Greek word which means guard. So guard before the migraine attack. That is the prophylactic treatment. For this, beta blockers like propranolol, timolol, tricyclic antidepressants like amitriptyline, imipramine are used. For anticonvulsants like valproic acid, topiramide are used. For calcium channel blockers, verapamil are used. CGRP antagonist, which mean calcitonin gene related peptide. CGRP means calcitonin gene related peptide. It is a new drug discovered which is used in the migraine treatment, that is erinumab, which is a human monoclonal antibody. I have given the important drugs which are mainly used. There are lots of drugs available. You can go through the books. Okay. Thanks for watching.